Welcome to Public Health Matters, where we talk about things that matter in public health, which are things that are very important for each and every one of us, because we all are partakers of our public health. My name is Bobbie Bagley, and I am the Chief Public Health Official for the City of Nashua and the Director for the Division of Public Health and Community Services, and I am your host this afternoon. I have with me our behavioral health strategist, Lisa Vasquez, and today we are going to talk about the epidemic of loneliness and isolation in public health. It is a public health matter, and it has been identified as such by the Surgeon General in a report that came out earlier this year. As he traveled across the country, Lisa, he realized in participating in listening sessions the devastation of loneliness in our nation and the impact that it's having on many in our country. And as our behavioral health strategist, you've been doing quite a bit of work around mental health, self-care. And so we wanted to talk with you and help our audience understand more things that we can all do to help promote better mental health and prevent behavioral health issues that can result from loneliness and isolation. And I just wanted to share just a couple of things from the Surgeon General report, because as I read it, as he was shocked as he went around the country, learning more and more about the impact of loneliness and isolation, I was as well, because these things are now considered public health issues, and they impact us at a rate of at least 1 to 2 adults are suffering from behavioral health or mental health issues. And this was pre-COVID initially, but now post-COVID, we're starting to see greater impacts, not just in adults, but also in children and adolescents as well. And the Surgeon General also related some of what we're seeing as bad as cardiovascular disease, hypertension, diabetes. He lists loneliness and isolation right up there with those chronic diseases that have been killing Americans for decades. And so, Lisa, in the work that you do, let's talk a little bit about some of the impact and also some of the things that we would like to promote and help our community do better with understanding about the impact of isolation and social connectedness.
Yes. I've been the behavioral health strategist for a few years, but I've been with the division for 10. And prior to COVID-19 pandemic, we were seeing the report that was about deaths of despair, which were related to suicide, deaths by suicide, and overdoses, and we're all linked to that feeling of loneliness and isolation. So now this is a wider report that focuses on more of the community, but also can be related to chronic disease and how that affects, or the effects of loneliness and isolation affects those chronic diseases too. Because if you have, for example, diabetes or one of the other like heart conditions, but you have a friend that you go out walking with, that you eat healthy with, you are less likely to have adverse effects or die or live shorter because of that. But that isolation piece is going to have a big impact in those chronic diseases, as well as people who are currently using substances or currently having some mental health crisis. That loneliness and isolation is going to exacerbate those illnesses and make people, unfortunately, sometimes have desperate measures for those.
Yeah, so I wanted to share just a little bit of some of the comments that the Surgeon General mentioned about why social connections matter. It's really important, and we talk about this a lot as far as relationships and relationship building. And one of the key factors that he mentions in this report is our relationships and interactions with family, friends, our colleagues, and even our neighbors are some of the ways that we can create social connectedness. And if we think about what happened during COVID, oh yes, the pandemic that shall not be named, right? Because nowadays people don't even want to hear the word COVID. But we learned so much coming out of that experience. And hopefully what we will do is continue to focus on how we can recover from this and implement some strategies that will help improve some of these health conditions that have come out as a result. But as the Surgeon General mentioned, prior to COVID, we were already looking at a mental health crisis in our country. And in fact, there was quite a bit of work that we were doing at the health department, along with our school, along with some of our other social, some of our other community-based organizations, with regard to things that we were seeing in our schools with the kids. And we're trying to think of strategies that we can help parents as well as teachers with overcoming the struggle that that kids were facing. So this was pre-COVID.
Yes.
And then you layer on what we needed to do to protect the most vulnerable in our populations, those that we didn't know how the disease was going to impact them. And we asked people to isolate. We asked people to not get together. We asked people not to socialize during the period of time that we thought was the most severest for many in our country. And as a result of that, an unintended consequence, nothing that we would have ever thought of would have come out of this, but it has. And so when we see this about, connections with others in our community, including our neighborhoods and our schools and our workplaces, these are things that allow for us to have quality in our relationships. So let's talk a little bit about how now can we rebuild some of those things, because now we're 3 years post-COVID, but we're now starting to see the tremendous impact of that in our lives today.
And we have a lot of data that supports having strong relationships. When we look at resilience, for example, and we're talking about adverse childhood experiences, we see that having one positive adult relationship in a child's life can buffer a lot of the adversities that they see in childhood. And the same thing happens for adults. When we have adversities as adults, strong relationships with family members, with our faith organizations, with our community, can buffer a lot of the effects that whatever situation or adversity we're going through happens. So we need right now to reconnect with our communities, with our neighbors, with our families, and build those bonds to be able to buffer whatever adversity may happen in life, because adversity is part of life as well.
Yeah, and life is going to happen, right? Things are going to continue to present to us in ways that we have to learn how to deal with these things, how to cope with these things, and being socially connected is a way for us to do that. So let's talk about some things that people can do to get socially connected. What are some simple things that don't cost a lot of money? And then we can even talk about some things that are even more costly, like going on a vacation.
There's so many things that we can do, and I think we're really lucky to live in the greater Nashua area, but specifically in Nashua, because there's so many opportunities for connections with so many of our community partners. I was just talking a little bit earlier about our wonderful public library and all the opportunities that they have for connection there. They have toddler reading time, they have activities for youth, for adults. Right now they're doing a series of music outside at lunchtime, which is a great opportunity to people to not only enjoy music, which is another skill or a tool that can be used to increase resiliency, but also connect with other people in the community and say, hey, you like this type of music? I like it too. Let's talk about that. Those are great inexpensive ways to connect with community. But then there's like our public pools. People go to our public pools, great place to connect with other people, our beautiful parks. And then there's activities like dancing in the park. That's gonna be July 21st, where people can not only have some activity and moving around with dancing, but there's gonna be great food, and there's gonna be other people that love music that you can interact with. So those are great ways that are, again, inexpensive to build community, and building community really builds resilience within ourselves, because you never know who you might need.
Right.
In Spanish, they have a saying that says, hoy por ti, mañana por mí, which means today I'm helping you, but tomorrow you may help me, which is what community is all about, right? One person might need help today. We all go take a casserole, check on them. But then the next day, I might be sick. I might need the support of my neighbors, my community, and that gets returned. And that's how we build not just community, but resiliency.
Right. And even for individuals that may have a little bit of anxiety, right, about being in social settings, there are ways that we can connect with our environment and connect with nature. Sometimes just going out and walking is a way for us to connect, and we can connect within ourselves, our own inner spirit, connecting, but doing things that draw out more of, who we are, as people, as individuals, and then connecting with others that are around us and even nature itself. And there's some science that supports the importance of doing that. One of the things that's mentioned in the Surgeon General report, because of the increase in social media are using things like TikTok, Facebook, and all those, it allows for people to kind of get by themselves and engage in those. But what we want to make sure that we do is, put some of those things down, as my phone is dinging right now, put some of those things down and really get connected with people. So talk a little bit more about some of the things that are going on in the community. So there are ways that we can, connect with individuals. We can connect with doing activities. What are some other things, Lisa, that you believe are important for us to do to counter the effect of isolation in the community?
Isolation and loneliness is something that's really specific, because some people might be by themselves, but they don't feel alone, they don't feel lonely.
Yes.
And some people can still feel isolated, lonely, or just loneliness, even in a group of people. So it's really important to do our own inner work to make sure that we feel okay with ourselves, with who we are, having pride in who we are, so that it helps us as well to ground ourselves in ourselves, which is a little above and beyond connecting with others. It's making sure that we connect with ourselves, and that will help us in turn connect with others. Because if we're not really connected with others, we're going to have that more superficial connections, which is what we see in TikTok and Facebook and all these other social media, is that you can have this feeling of connecting with people when you're really not connected at all. You can have millions of followers and still have no meaningful connections. So we want to make sure that people do that inner work, know what they like, know things that make them happy. How do they find joy in, with themselves? Is it reading? Is it knitting? What things bring them joy? Is it cooking? And then from that, they can then share that skill, that tool, that hobby with other people, and it's a way to connect with others.
Yeah, and I'm glad that you brought up the distinction between the feeling of loneliness and that's just not based on being either by yourself or being with others, because it's more than just a feeling. It's actually a state of being. And so thank you for that clarification. One of the other things, Lisa, that I wanted us to talk about was the fact that July is actually BIPOC Mental Health Month. And this actually was started back in 2008 as National Minority Mental Health Awareness Month. But it has changed and shifted from using the word minority to BIPOC Mental Health Month, again, because of some of the stigma that's associated with just the use of the term minority, because it then puts this power dynamic in there with minority and majority, and that also then adds on to some of the anxiety or some of the angst that we may see in some of our Black and Brown communities when it comes to addressing or identifying some of the impact of depression, social isolation on individuals in those communities. And we've also experienced and we've also learned, from the work that we do, we've learned from research that there is a disparity when it comes down to individuals that represent Black and Brown communities and accessing services to address their mental health issues. So let's talk a little bit about that, because I know this is your your corner of work, where you have done a great deal of work in the community to try and narrow and close some of those gaps when it comes to access and helping to promote awareness of the importance of seeking help when that is actually needed in those communities.
Just to start off, language is so important. So, and that's one of the reasons that we are constantly changing some of the words that are used. So, from Minority Mental Health Awareness Month to BIPOC Mental Health Awareness Month, because we want to take away any stigma to accessing services. And I think we were talking about it earlier when we were talking about not just the lack of or the shortfall that we have with staffing. A lot of our mental health workforce capacity has been diminished after COVID-19 due to sometimes people going to work in more telework, private work, sometimes the working in the community is not seen as desirable to some new grads and things like that. So we're working up on building the workforce because it's so needed in the community. And we know that the people that are there now are just super passionate and that's why they're there. But we need to build up that capacity and build it up in a way that's diverse. And that doesn't always mean, having representation to the same level, because sometimes that's just not possible, but it's also creating educational opportunities for the staff that is available so that they are able to work with anyone from any background as well. So it's both things, increasing the diversity of the workforce and also increasing the education of the workforce to serve the diverse community. So those are things that we've been working on. One of the things that we're doing from the division is providing cultural diversity and cultural competency training to agencies in the community to be better able to serve our diverse, our diverse community. But also talking to our community members in their language, with people in the community, with people that they trust, to let them know that services are available, and it's okay if your provider doesn't look exactly like you, because they're getting education to be able to work with everybody, and that the skills that they've learned can help them as well. So there's a lot of teaching, not just on one side, but on both. And we know that some people have been hurt in the past by some research or trials or things like that, and just some trust might have been broken within those communities, and now it's about rebuilding that trust and making sure that we're always transparent in being able to provide services to all communities.
Yeah, and that's really important, because one of the things that we don't want to do is we don't want to pretend that things didn't happen, right? We want to acknowledge our past, in this country. We want to acknowledge things that may be, systematically institutionalized, so we can address those, so we can disrupt some of that, that past history with making some new journeys, for ourselves in the work that we do, especially when it comes to behavioral health and mental health, because there's a lot of stigma, that still exists because of things that were done that were considered treatments, or they were considered allowable, which those things aren't these days. And so we've come a long way in changing how we provide services and changing what is, appropriate services. And, the goal today is to make sure that everyone has, access to services, and that we do that in an equitable way across all of the different services that are available for mental health and behavioral health. And we don't want any population to feel that they cannot get the services that they need. Because as you mentioned, there's been quite a bit of training that's been offered, and we have folks that are taking advantage of the trainings to improve services, make things more efficient, make things more effective at getting to what the root causes of some of our issues might be. So we really want to encourage people in the community to do some things to create or increase social connectedness in their communities, whether it is getting together with family, getting together with friends, whether it's going to churches and synagogues or mosques, whether it's going to concerts, right? Those might be other ways that folks can connect or have some connectedness with their community and with their surroundings. And so we want to encourage that in folks. What we've heard or what we're hearing right now is that we are in a state in our country, and we're seeing this in New Hampshire as well, where we're dealing with a serious mental health crisis that is impacting not just adults, but also young people, even down to the age of children. And so we want to make sure that folks are aware of the importance of seeking services as needed and taking advantage of doing some of these other things that can help prevent a mental health crisis.
Yes, and remembering that the services that are provided are a continuum. It doesn't mean that everyone's going to need emergency services. It doesn't mean that everyone falls within one specific category. You can fall within anywhere within the continuum. So if you wake up, you're having a bad day, you might just need to talk to a friend and you'll feel better. But if that doesn't work, there's more levels of support within this continuum of mental health care that should be available to every single person in our community. And we just want you to know that there are services across the continuum that you can access. So yeah, call 211 or call our community mental health center, or call your insurance company to find out where you can go if you need that type of service. But again, it's a whole entire continuum, and many people might feel like, oh, I'm not ready to talk to a therapist. I don't think I need that. I might feel better talking to my pastor, or talking to someone within the clergy, or talking to my yoga instructor, or wherever you feel that you can get that support, connect with that person. If they feel that they cannot help you and that you might need a different level of support, they will let you know and say, hey, I'm so glad that you opened up to me and were able to talk about this, but maybe we need to connect you to someone else who can help you a little further.
Yeah, and that's how we build resilience in our community. So we all play a role in protecting the health of our neighbors and our friends and of ourselves. And so we can all help people feel connected by being welcoming, by being open. Sometimes it's a simple thing of just greeting a person. Sometimes it could be as simple as just a smile. All of those things matter, and all of those things do make a difference. And some of those things are done at no cost. How much does it cost to smile? Yeah. How much does it cost to acknowledge, another person in the room or in the space that you're in? And these are ways that, as members of the same community, how we can all help each other move past this feeling of disconnection and this feeling of I'm alone. And I had the opportunity, Lisa, to read something that you wrote about feeling isolated or even feeling alone, even in the midst of a group of people. And there are ways that have helped you get past that. What are some things that you like to share to help even some of our people that are watching and listening to this right now help get past some of the loneliness that they might feel? Because it just takes taking that first step, right, and acknowledging that this might be something really that you're experiencing.
Yeah, I think what I wrote was specific to a book that I read, which was
and
called
what was that book?
Brown Enough by Christopher Rivas, and it really talks about being brown in America. So being Latin American, the author is half Dominican, half Colombian. I felt, since my parents are Dominican, very connected, and just thinking about all the expectations that you have, not just from your parents, but from society, and people having a lot of specific expectations of you because of the way you look, that things are going to go one way or another. That, for example, someone is at a store and someone comes up to them and says, hey, do you want a job? And they're like, what? Oh, I need someone to clean my house. Well, because my name is Maria doesn't mean I clean houses. Like, just kind of those kinds of experiences, for example, or make you feel very isolated, make you feel like you're not seen as a person, you're seen as a stereotype, for example. So that's what I was talking about in that book review. But
And those things
they
can affect a
happen.
person's mental health status, right?
Yes,
and
they
again, help create that sense of isolation or loneliness, because you don't feel like you're really connected, but you feel like you're an outsider, right? And so a part of acknowledging National BIPOC, Mental Health Awareness Month is helping people understand, again, as being a part of the community, how we can help each other overcome some of those feelings, some of those emotions, some of that context in our lives and how we live, but just being mindful of maybe something that we could say, to another person if we don't think before we speak, right?
Okay.
That can actually impact a person's ability to feel like they're connected to a community.
And one of the things that we can do is very simple. Again, be mindful of our language. Language is super important. When we use words, we put energy into those words, and we set that energy out into the world. So using person-first language, if we're not talking to Bobbie specifically, is really important. If providers are talking about people, if not labeling people, but using person-first language. So if someone is diagnosed with an illness, they're a person with that illness. They're not defined by that illness. That illness does not say how their life is going to be. It's just something that they're experiencing. Just like homelessness, right? It's a person experiencing homelessness. Homelessness is not their whole personality. It's not doesn't define them. It's just an experience that they're going through at this moment in time. So making sure that we use language that empowers people and lets them know that they have humanity, that we see them as human beings, is important for our mental health, for the resilience of our community, for making sure that every person in our community feels like they belong.
Lisa, thank you so much for being here to have this conversation about isolation and social connectedness. Is really important for us to really help our community get back on track, get connected, and feel like they belong, because we all do. And this will help go a long way with building that resiliency that we want to see in our communities. So we thank you so much for being a part of our discussion of public health matters and addressing isolation and social connectedness. And what we want you to take away from this is to think about what are some things that you can do to help build connections with others in your household, in your community, and what are some things that you want to pay attention to your own self to help you make it through certain situations or circumstances that can happen in our life, because life happens, to help you maintain your sense of well-being. Thank you for joining us, and we look forward to seeing you next time.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.